All right, let's dive into the world of burns and corrosions and how we code them.
Yeah, get ready. It's fascinating stuff.
We're using excerpts from the Absolute Medical Coding Institute's Medical Coding Guidelines, or MCG manual. We've linked that in the description if you want to follow along.
Definitely a good idea.
So burns and corrosions both cause damage, but how are they different?
Well, it all comes down to the source of the damage. You see, burns, those are from heat.
Oh, I see. So like fire.
Yeah, fire or a hot stove.
Makes sense.
Now, corrosions, on the other hand, those are caused by chemicals.
Oh, okay. So like acid or...
Yep, things like that.
So one's like a sizzle and the other one's like a fizzle, but the coding guidelines are the same for both.
Exactly.
All right, that makes sense. Now, the guidelines classify burns by depth, extent, and cause. But I think the depth part, that's what always gets me. I mean, we've all heard of first, second, and third degree burns, but how does coding really capture all those nuances?
Well, it goes beyond those common terms. For accurate coding, documentation needs to be very precise.
Right, so it's more than just, slapping a label on it.
Yeah, think of it more like a spectrum of severity.
Okay, it's spectrum.
Yeah, so first degree, that's like a mild sunburn.
Oh, yeah.
It affects only the very top layer of skin.
Mm-hmm.
Then you have second degree burns, and those go deeper. They're the ones that cause blisters and swelling.
Oh, yeah, those are no fun.
And then you've got third degree, the most severe kind of burn.
Right, where it goes through all the layers of skin.
Exactly.
Man, it makes you really appreciate how important that detailed documentation is.
Absolutely, because that level of detail,
Yeah.
that directly impacts the treatment decisions.
Oh, for sure.
So a first degree burn, you might just need basic care,
Right.
But a third degree burn could require surgery and extensive hospitalization.
Yeah, that's a whole different ballgame.
And plus, this level of detail helps to ensure resources are allocated effectively,
Oh, that's interesting.
making sure that burn centers are equipped to handle the cases that they are receiving.
So those codes are doing a lot of work behind the scenes.
They really are.
Okay, so now here's something I'm curious about. The guidelines mention that burns of the eye and internal organs are classified differently. Why is that?
Well, for these types of burns, we classify them by location only, not by degree.
Huh. Okay, so what's the reasoning behind that?
Well, it's largely due to the challenges of assessing burn depth in these
I
areas.
can see that.
Like with internal burns, it can be tough to determine how extensive the damage is right away.
Right.
And with eye burns, the focus is really more on the specific structures that are affected,
Oh,
like the cornea, for example.
so it's about tailoring the coding system to the unique nature of those injuries.
Exactly.
Now, imagine a patient comes in with multiple burns. Let's say a second-degree burn on their arm and a third-degree burn on their leg.
Yeah, classic scenario.
How would you go about coding that?
Okay, well, when you have multiple burns, we always sequence the code for the highest degree burn first.
Okay, so in this case, it'd be the third-degree burn code.
Exactly, and that way it instantly conveys the overall severity,
Okay, yeah, that makes sense.
which is crucial for data analysis and treatment planning.
So it's like a hierarchy of severity.
You got it.
All right, what if that leg burn also had some areas of second-degree burns within it?
Oh, interesting.
Would you need a separate code for those less severe burns within the same area?
Nope, not at all.
So you just go with the most severe code for that area.
Exactly.
All right, that keeps things a bit simpler. Now, what about those situations where burns just don't heal as expected, or even develop necrosis?
So in those cases, those are still classified as acute burns.
Okay, so even though they're not healing, they're still considered acute.
Right, because non-healing burns often require ongoing treatment,
Right.
and they also have a higher risk of complications.
I see. So the coding reflects that ongoing need for care.
Exactly.
And I'm assuming that if a burn gets infected, that would also require its own code, right?
Absolutely. It's essential to capture all aspects of the patient's condition.
Right, because an infection adds another layer of complexity to the treatment.
It really does.
So each code is like a piece of a puzzle, painting a complete picture of what's going on.
That's a great way to put it.
Now, what about when someone has burns on multiple body parts? Does each location get its own code?
Yes, absolutely.
Okay.
The guidelines are very clear on this. Each distinct burn site needs to have its own code.
There's not just one code for burns on multiple sites or something like that?
Nope, each one needs its own.
Okay, so if someone has burns on their arm, leg, and chest, each of those would have its own specific code.
You got it.
Wow, that's a lot of codes.
It is, but it's important.
And I imagine it's incredibly valuable for research purposes as well.
You're exactly right. This level of detail allows researchers to study burn patterns, identify risk factors, and ultimately develop better prevention strategies.
So it's about moving beyond those individual cases and understanding burns on a larger scale.
Exactly.
It's remarkable how something as technical as coding can have such a broad impact.
It really is.
Now, I remember you mentioned something called the rule of nines earlier. It sounds almost like a secret society rule or something.
It does, doesn't it?
So what exactly is this rule of nines all about?
It's a method for quickly estimating the percentage of body surface area, or BSA, that is affected by burns.
Oh, okay. So it's a way to assess the extent of the burns.
Exactly.
So how does it work? Is it like a formula or something?
Well, it's more like a mental map that divides the body into sections. Each section represents a multiple of 9%.
Oh, I see. So that's where the name comes from.
Yeah, pretty clever, right?
Okay, so walk me through it. How's the body divided up in this map?
Okay, so picture this. The head and neck, that's 9%. Each arm is also 9%.
Okay, so that's 18 plus 9, 27 so far.
Right. Then each leg is 18% because they're longer, of course.
Of course.
The front of the torso is another 18%, and the back is another 18%.
And what about,
And finally, the genitalia represent 1%.
Oh, okay, so all that adds up to 100.
It does, yep.
Okay, so let me see if I've got this straight. If someone had burns covering their entire right leg, that would be 18% BSA.
Exactly.
Wow, so it's a pretty straightforward way to get a quick assessment.
It is. And that helps determine the severity of the burns.
Especially in those, critical moments right after the injury.
Right. It helps healthcare professionals make quick decisions about treatment.
So it's like a quick reference guide for burn severity.
Exactly.
Now, are there any exceptions to this rule of nines? Like, what about infants and children?
That's a great question, and you're right to think about that. Infants and children, they have different body proportions than adults.
Oh, yeah.
They have proportionally larger heads and smaller limbs.
Right.
So there are adjustments made to the rule of nines to account for those differences.
That makes sense.
You wouldn't want to use the same proportions for a tiny human.
No, not at all. Now, shifting gears a bit, let's talk about the long-term consequences of burns. I'm thinking about things like scarring and restricted movement.
Yeah, those are big ones.
So even after a burn has healed, there can be lasting impacts on a person's life.
Absolutely. And those are known as sequelae.
The sequelae, okay.
It's basically the lasting effects of an injury.
So it's like the burns legacy in a way.
Yeah, I like that.
How do we code for these sequelae?
Well, they require a specific code, a burn or corrosion code with the 7th character S.
Okay, so that S signals that we're dealing with the long-term impact.
Yep, not just the initial injury.
And that's important for tracking the need for ongoing care, right?
Absolutely.
Things like physical therapy or even psychological support.
Exactly.
Because healing from a burn goes far beyond just treating the initial wound.
It really does.
Now, imagine someone who has both a current burn and sequelae from a previous burn.
Interesting scenario.
How would you code that?
Well, in that case, you would need 2 separate codes.
Makes sense. One for the current burn and one for the sequelae.
Exactly.
So it's about capturing the full picture of the patient's condition. Now, you mentioned external cause codes earlier, but we haven't really dived into those yet. What are those all about?
Think of external cause codes as the context surrounding the injury.
Oh, okay.
They tell us about the circumstances of the burn or corrosion.
So it's like, here's what happened, but in code form.
Yeah, kind of like that.
So what kind of information do these codes capture?
Well, they tell us about the source of the burn.
So like, was it fire, hot liquid, electrical?
Yeah, all of that. They also tell us the intent.
Intent.
Yeah, so was it accidental, self-harm, or something else?
Oh, I see. That's important information.
It is. And then they tell us the place where it happened.
So like at home, work, out in public.
Exactly.
So these codes are like adding those extra details that give us the full story.
Precisely. And those details are crucial not just for individual cases, but for public health initiatives and prevention strategies.
Oh, I see what you mean.
By analyzing patterns in these codes, we can identify trends and risk factors.
And then focus on prevention efforts where they're most needed.
Exactly.
So we're not just documenting injuries after they happen. We're potentially preventing them from happening in the first place.
Exactly.
That's pretty amazing.
It is.
It really underscores how important accurate and thorough coding is.
It goes far beyond just billing and reimbursement.
It helps us understand trends, improve patient care, and potentially even save lives.
It really does.
Well, you've definitely given me a new appreciation for those codes. I'm starting to see them less as just technical jargon and more as a way to really make a difference in healthcare.
I'm glad to hear that.
Well, we've covered a lot of ground today, and my brain is definitely feeling full.
I bet it's a lot to take in.
It is. So I think it's time for us to let all this information sink in for a bit. But don't worry, we'll be right back.
See you soon. We're back and ready to dive even deeper into the world of burn and corrosion coding.
I'm feeling like a coding detective, ready to solve some medical mysteries. But before we get to those complex cases, I'm curious, how do you personally use the MCG manual in your work?
Oh, the MCG manual. It's like having a seasoned coder by your side, especially when I'm dealing with those tricky scenarios.
Makes sense.
One section I find myself going back to a lot is the one on sequela.
Oh, yeah, sequela, those long-term effects.
Yeah, it provides really clear guidance on differentiating between conditions that are directly related to a burn and those that aren't.
That makes sense, because establishing that cause and effect relationship, that's crucial for accurate coding.
Absolutely.
All right, well, let's put our knowledge to the test here. Imagine a patient comes in with burns covering their entire chest and abdomen.
You know what? There actually is. There's a code for burns of the trunk T31.4.
T31.4. Got it.
And it just simplifies the coding process when the burns cover both the front and the back of the torso.
Okay, so T31.4 captures that 36% BSA involvement. And of course, we wouldn't forget those all-important external cause codes.
Oh, never.
To give us the context about the incident.
Right, all the details.
All right, now let's shift our focus back to those long-term consequences, the sequelae. Let's say we have a patient who was in a house fire years ago and sustained significant burns on their arms and legs. They've come in for a chronic skin condition that's directly related to those old burns.
Okay, I'm following you.
How will we go about coding that?
All right, so since we're dealing with a long-term effect of the burns, we're going to use those S codes for sequelae.
Right, the S for sequelae.
And it's important to remember that each affected site gets its own S code.
Oh, okay, each site.
Yeah, so if the patient has chronic skin issues on both their right arm and left leg due to those old burns.
We'd need two separate S codes.
Exactly, one for the arm and one for the leg.
Got it.
That way we can capture the full extent of the long-term consequences and ensure that the patient receives appropriate ongoing care for each affected area.
It's like we're piecing together a complex puzzle, making sure every piece is in its rightful place to get that complete picture.
You got it.
Medical coding, it's really about translating complex medical information into a standardized format.
It is. It's like a language that we use to communicate across the healthcare system.
And that language has a real impact on patient care, research, even public health initiatives.
It really does. It's pretty amazing.
Speaking of impact, remember those non-healing burns we talked about earlier?
Yeah.
What happens if a non-healing burn develops complications, like an infection?
Oh, that's a great question.
Would you need additional codes to represent those complications?
You absolutely would. Just like with any other injury, if complications arise from a non-healing burn, we need to code those complications specifically.
So we're adding layers to the coding to paint that multidimensional picture.
Precisely. It's all about making sure that every aspect of the patient's condition is documented and addressed appropriately.
I'm starting to appreciate the art and nuance involved in medical coding.
It is an art, in a way.
It's about precision, attention to detail, and really telling the patient's story in a way that ensures they receive the best possible care.
It is. It's an art of accuracy and clarity, essential for effective communication and ultimately optimal patient outcomes.
Well said. Well, you've certainly illuminated this intricate world for me. I think we've earned a moment to pause and let all this knowledge sink in. We'll be back shortly to wrap up our deep dive and leave you with some final food for thought. And we're back for the final leg of our burn and corrosion coding deep dive.
It's been quite a journey, I'd say.
Yeah, we've talked about depth, extent, cause, sequelae, even those external cause codes.
Those are so important.
They really are. They add so much context.
They do.
And, one theme that keeps coming up throughout our discussion is the importance of specificity.
It's true. You really hit the nail on the head with that one.
It's not just about finding a code that's, kind of close.
Right.
It's about capturing those fine details.
Exactly.
The ones that really reflect each patient's unique situation.
Yeah, that's what it's all about.
And that level of detail, it has implications that go far beyond just the individual patient.
Oh, absolutely.
Remember how we talked about those external cause codes? How they can be used for research and public health initiatives?
Oh, yeah, for sure.
Like tracking trends and risk factors?
Exactly. That's right.
By analyzing the patterns in those codes,
Right.
we can identify areas where prevention efforts are most needed.
Yeah, I mean, like, for example,
Yeah.
if data shows that there's a high number of scald burns among young children,
Yeah.
that might trigger a campaign to promote water safety in homes.
So it's not just about documenting injuries after they happen. It's about using those codes to try to prevent those injuries from happening in the first place.
Exactly. It's about being proactive.
It's like we're turning data into action. And accurate coding is the foundation of that data-driven approach to public health.
It really is. It's the starting point.
It allows us to step back and see the bigger picture.
Right.
And make decisions.
Informed decision.
Yeah, informed decisions that can actually save lives.
It's powerful stuff.
It really is. It's pretty amazing how something as technical as coding can have such a huge impact on healthcare as a whole.
It really is. And I think it just speaks to how interconnected everything is.
Yeah.
You know, from the very precise documentation of an individual burn to analyzing trends at a national level, it all starts with those codes.
Well, you've given me a whole new perspective on the power of these codes.
I'm glad to hear that.
I'm starting to see them less as a billing requirement and more as a tool.
A tool for
understanding and improving healthcare.
Yep, that's exactly what they are.
It is. And that's the key takeaway I hope everyone listening walks away with today.
I agree.
Burn and corrosion coding. It's about so much more than just assigning numbers.
It's about telling a story, capturing the nuances of each case.
And using that information to make a real difference.
To drive positive change.
You said it perfectly. We've gone from the basics of burn classification to the complexities of sequelae and those external cause codes.
It's been quite a journey.
It has. And along the way, we've seen how those codes have a ripple effect.
Yeah, they do.
Impacting research, public health, and ultimately, patient care.
It's all connected.
It really is. And it's been a pleasure diving into this world with you.
Likewise, the pleasure was all mine.
I've learned so much, and I'm sure our listeners have too. So everyone out there, thank you for joining us on this deep dive into burn and corrosion coding. We hope you've gained some valuable insights and a newfound appreciation for the importance of these codes. Until next time, keep those coding brains firing.